Hi, I'm Dr. E.Moghimi. This is my fourth case presentation in the field of aesthetic medicine. In my past videos, I have shown some of the early and late complications of filler injection. And in this video, I want to talk about one of the serious cases that was occurred 1 month ago for one of the patients that was referred to us for treatment plan. This was a case of internal occlusion of facial artery after filler injection in nasolabial fold. I invite you to see the clinical patterns of the occlusion and the signs and symptoms of skin discoloration of the face after this unexperienced injection. Fortunately, we tried to have the best plan for treatment. We did the best treatment for this patient, and our treatment was effective after doing our plan. If you liked this video, I invite you to subscribe us and follow us for watching our future videos. So I want to talk about this case from the first step when he was referred to me about 5 months ago, just near the Iranian Nowruz holidays. Iranian Nowruz holidays begins at the first day of the spring, Iranian spring. So, one of my co-workers from a city in northwest of Iran sent me this picture and said that after injection of filler, this patient came back to me after 2 days and said she's suffering a huge pain and a terrible discoloration of the face. This is the face discoloration, and to me it was obvious that this pattern of discoloration is about an occlusion process which was occurred after filler injection. With the blue arrow shows the injection site. Our co-workers injected according his detail. He injected 1.5 milliliters of fillers in nasolabial folds, but I think filler was introduced in the facial artery, and red arrow shows a tiny pustular eruption showing the infection. But in this slide you see the pattern of discoloration from the nasolabial fold upward toward the corner of eye, and you see that discoloration is going to the medial contours of the left eye. This is a very critical situation because it shows that obstruction is very, very dangerous because it may occlude the retinal vessels and lead to sudden blindness. When I asked my coworkers that where did he inject the filler, he said that I only injected the filler on nasolabial fold, mainly at this point. But after 2 days, obstructions went upward, and as you see, the inner contours of eye is showing the facial artery branches that are obstructed. Also, in the limitation of blue line, as you see on the upper lip, this is a mottling pattern which shows the ongoing ischemic event in upper lip. In other words, we thought about upper lip vessel occlusion as well as occlusion of upper branches of facial artery toward the inner contours of the eye. In this case, it is very important to do the emergency action, and our emergency action was to inject hyaluronidase, about double strength hyaluronidase on the injection site, just into the injected filler. As I was not with the case in that city, I ordered my coworker to inject 0.5 milliliters, about 1,000 units, because our ELAs was double strength. It was diluted with half volume solvent. So it was 1,000 units that was injected in the main point, and then about 400 units in the upper points that is shown in this picture. In other words, Hyaluronic injection was divided into 5 points, and the main injection was in the main injection of the filler. Before injection, the patient was suffering with huge pain that was not controlled by any NSAIDs or coordinated tablets, and the pain was so huge that she needs some injections for subsiding the pain. But after the injection of the hyaluronidase, only 1 day after injection, the pain was subsided and patient was free from any pain. In this picture, you see that in the point marked by green another injection was done for the probable obstruction of any vessel. And this is the picture of the case after the injection of Helase. As you see, a hematoma pattern is seen, and the patient says she felt a rigid toughness under her skin when the hyaluronidase was not injected. But after injection of hyaluronidase, the skin was smooth without any rigid feeling and without any pain, and this pattern was subsided with using painkiller tablets, over-the-counter painkiller tablets. And then this was the final clinical picture after 1 week. As we see in this picture, the obstruction is relieved from the upper lip and the branches toward the eye. It seems that blood obstruction was relieved, and there is some blood leakage in the interstitial fluids around the main branches, and the patient was so lucky to have this clinical concept. I'm so honored to say that with a on-time planning and with effective treatment, this patient was cured, and there was no serious scar on the face. I think this case presentation will be useful for your clinical practice in future. If you have any other question about the ischemic accidents after filler injection, you can ask me through the phone number that I was written in the comments. If you liked this video, please subscribe us and follow us. We will be so honored to inform you our future videos about case presentation. All of these cases are copyrighted and originally produced by us from our cases that are referred to me from my colleagues all over the world and all over the cities in the Iran. Thank you very much. I invite you to watch my next case presentation.